Okay, good evening to everybody, or well, good afternoon to everybody joining us from...
We're not there yet, sorry.
Okay. Sorry, I wasn't sure if I had to speak already, or I don't know. Can you please just...
I tell you, yeah.
Okay.
I answered your question thinking that you were asking if we are ready.
Good evening to everybody, or well, good afternoon to everybody joining us from South or North America. My name is Christina Hinz. I would like to welcome everybody to the Rosa-Luxemburg webinar, Feminist Insights, Resilience and Resistance in Times of COVID-19, featuring our amazing speakers, Aniele Franco from Brazil, Christina Carte from Jordan, and Rajika Menon from India. Well, why talk about COVID-19 from a feminist perspective? And yeah, why should we share knowledge gained by human rights defenders and feminist activists during this healthcare crisis? Well, I think the more appropriate question would be, how can someone want to do it? And why didn't we have this conversation so much earlier? Until the date, the pandemic has claimed more than 70 million infections and over 1.5 million deaths, noting that the winter has just started here in the north. Women have been at the forefront of the so-called combat against the pandemic and its related adversities. And still, our contributions have not been much appreciated, as usual, I would say. The list of these related adversities of COVID-19 is a long one. Poverty, police violence, domestic violence, disownment and cutback of workers' rights. And yes, also the international attack on our reproductive rights. Just to name a couple of examples. In order to learn more about these gendered effects of COVID-19 and to gather intersectional feminist responses to this pandemic, Rosa-Luxemburg's Global Feminism Program has launched in August a web dossier entitled Feminist Insights, Resilience and Resistance in Times of COVID-19, which Isadora Zubek and myself had the honor to edit. This collection brings together a series of original articles written by female activists, unionists, human rights defenders, and journalists based and active in countries of the Global South. And well, we will post a link to the dossier in the comment section on either YouTube or Facebook, whatever you're watching. So please make sure to check it out because there's some really, really brilliant articles in this dossier. So after having launched this collection, of course, we wanted to continue this discussion about the gendered effects of COVID-19. But we also wanted to take the opportunity, considering that we're already some months in this pandemic and that the year is ending. And we wanted to look back on the last month and ask ourselves, actually, what did we learn so far? What were our main lessons? And what did work in our activism and what did not work? And also, of course, seizing the opportunity that we have these amazing guests here with us tonight, work with feminist activists and organizations in other countries, such as Germany, for instance, learn from these feminist mobilizations and experiences in countries of the Global South. And what piece of advice could actually be given to fellow feminist activists across the world? And I think the intuition for asking this question is actually quite forward, because if the last months have taught us anything, then that these taken for granted policy approaches, they did not work too well in 2020. And they also probably are not going to work so well for the problems we're going to face in 2021. And we might need to think a little bit outside of our box and make as much usage as we can of this knowledge gained by these women who day to day stand at the front lines and protect their communities, not only against the worst consequences of COVID, but also against everything else that has been gone wrong long before that. So in order to tackle these questions and to discuss this here with our amazing guests, we are going to conduct this webinar in like some Q&A style. And we're also going to have some space for your questions at the end. So please post your questions in the comment sections of either Facebook or YouTube. And if you happen to be not to be a member of any of those and you want to ask the question, so there is also a link we posted to a pad where you can write down your questions and they are going to be registered. And well, before we dive in, just one more announcement. Please also sign up for the Rosa-Luxemburg Global Feminism newsletter. Also, the link you're going to find in the comment section. So make sure to download the dossier and also sign up for the newsletter. Okay, so I'm going to stop talking and I'm going to ask the first question right away that our participants here will explore. And I'm going to present the speakers here with more detail as they come in, let's say. So the first question we want to discuss here, in your area of activity, what were the main challenges during the COVID-19 pandemic? How did authorities in your country respond? What were the main policy measures taken? And how did these measures, these official measures, actually aggravate pre-existing problems or create new ones? And I think we can maybe start with Agnelli Franco. Agnelli Franco grew up in the Maré favela in Rio de Janeiro. She holds a bachelor's degree in journalism in English from the Central University of North Carolina and another bachelor degree in English literature by the State University of Rio de Janeiro. She holds a master's degree in journalism in English by the University of Florida, A&M, and is currently pursuing another master's degree at Cefet University in Rio de Janeiro, studying ethnic racial relations with a focus on the identity of Black women through the memory and legacy of Marielle Franco, her sister and daily inspiration. Recently, she published her book called Letters to Marielle and has important participation in many other books, including the autobiography of Angela Davis. Today, she works as a teacher, a public speaker, writer, and is a current director of the Marielle Franco Institute, curator and presenter of the Papo Franco channel, and also of the School of Marielles. And she's also a guest columnist of the Marie Claire Brazil magazine. We are so happy to have you here, Agnelli. I think after the long introduction, maybe the audience might have lost track of the question, so I'm going to ask it again. In your area of activity, what were the main challenges during COVID-19 so far for women? And how did authorities respond? And which kind of measures actually made sense and which kind of measures actually made things worse? What's your perspective on this, Agnelli?
Yeah. First of all, good afternoon, everyone. Thanks for being here. Thanks for the invitation. And it's a pleasure to be here sharing this table with such three important women. Well, in Brazil, we had many challenges. I mean, actually, we're still having, because unfortunately, our president, the authorities are now just starting to thinking about what actions they're going to take towards COVID-19. But something that I would like to highlight in my first answer would be that here, the majority of the Black women, they work either at home or in other people's house. So they had to leave their house to go to work. So the first death that we had in Brazil, the really first one, was from a Black woman who was a housemaid in a house of a very rich person. And these people said they would not let her be at home because of the pandemic. Our first challenge is that, first of all, we don't have a leader, in government right now. We don't have no one to look and say, hey, let's stood up here because these poor women or people or whatever they need to. No. And the one that was, in my opinion, one of the biggest one was that right in the beginning, like March, when COVID-19 arrived here, we didn't have water in most of the places. So you had many women who were trying to survive with their kids with the basic things they didn't have. So no water, no soap, no, like no alcohol to clean their hands, like nothing. And we had to put up with some stuff like many people dying from the slums because of that. And at the same time, we don't know what to do. So government start with the emergency auxiliation in April or June, if I'm not mistaken. But up to then, they didn't have any money, they didn't have no food, they didn't have how to get to work, they didn't have anything. So we kind of start looking up for these women, and we create some ways of helping them with other organizations here in Rio, especially in Rio, to go around and give food and give them especially some water and help these women, especially with their kids. So basically, the main challenges and the big challenges were these. And only 3-4 months after that, authorities started giving some money to help those people. That would be my first answer.
Yeah, well, thanks, Aniele. I think, well, most people have read a little bit about the situation in Brazil, and yeah, it really sounds rough. I think maybe we can continue with Christina to give us some perspective about what happened so far in Jordan and during the pandemic. Well, Christina Cahtu is an educator, a translator, and a feminist activist currently based in Amman, where she's writing feminist podcasts, co-facilitating a feminist reading club, and contributing to the work of feminist groups in Jordan. So, Christina, in your area of activity, what were the main challenges during COVID-19, and how would you evaluate the government responses?
Good evening, everyone, and thank you so much for organizing this very important conversation. I do agree that there will never be enough of documentation and discussion as long as the problems are aggravating instead of being solved, as you mentioned in the introduction, Christina. So in order to understand a little bit the situation of Jordan and the consequences of COVID and the lockdown here, I would like to give a little bit of context about the women's rights situation even before the lockdown or before COVID. Women have been discriminated against for a very long time now, despite all the efforts constant of activists and women's rights organizations. They've been pushed out of public spaces, be it laws and regulations and policies, or be it the labor market, where there's only 14% of women, which is a very low participation rate. Although there are many women who do actually graduate universities, the majority of people who graduate universities are women, but then they never make it to the labor market. So that's on one side. And then even in the domestic sphere or the private sphere, their rights, they were never safeguarded neither by the culture and tradition and the mentality of the people, nor by the laws. And what COVID did is basically it just like all those issues, they've been there hot water under the ground. And what COVID did, it just made it explode in our faces, just to show us one more time that these problems and the solutions to these problems are long overdue. And why I'm emphasizing law, because in Jordanian constitution, it says that all Jordanians are equal in the eyes of the law, regardless of their language, race, or religion. But sex is not one of those things. And there is a lot of discussions that have been happening about the importance of this term in the constitution. because some say that it's implicit, but unfortunately it's not implicit. And one of the very good proofs to the fact that it's not implicit is that women until the age of 30, until now in Jordan, they have to have a guardian, be it the father, it's a male figure. So if it's either the father, the brother, or the husband. And when I say guardian, it does not necessarily mean that they do need to get written consent, let's say, to get a specific job or to study in a specific university, but they do need verbal consent. And in case the guardian does not like what the woman is doing, they have the right to file a complaint against her, and that has been happening in the country. So that's a little bit of a context. And in Jordan specifically, in terms of COVID-19, the country went into total lockdown on the 21st of March. And that total lockdown meant that all trade and all activity was suspended for about 10 days. And that included no one was allowed to leave the house unless there were essential staff in hospitals and in some governmental institutions. Everything was moved online, schools were shut, you couldn't even go to the grocery store for some time, or the only thing you were allowed to do is to go and throw out your trash, but with very strict measures as well. And that strict lockdown, it eased up a little bit, but and when I say eased up, it meant that we could, until almost May, we were not allowed to leave houses, public transportation was not running, everything was still online, including schools and work and all that stuff. But you were allowed to go on foot, let's say, to get grocery shopping or stuff like that in your area. In summer, the measures eased up even more sectors were opened until the second wave hit again, where schools, nurseries, kindergartens were closed again. And I'm going to get back to the issue of nurseries a little bit later, because there was some very important feminist work that was done in that aspect. And obviously the consequences were many. It's very hard to, I was saying before we started that it was very hard for me to pick, because the more you are vulnerable, or the people who are the most vulnerable basically were hit the most. So I'm talking about economic crisis, I'm talking about mental health crisis, I'm talking about family crisis, family disputes. And all that resulted in basically a lot of women either withdrawing from the labor market because they have increased house chores, so they need to take care of the online learning of their kids, of the increased house chores, maybe taking care of an elderly family member, etc., more than usual because everyone's at home all the time. So that's a lot of mental, physical, and emotional labor, obviously. So they either withdrew from the labor market because they're the primary caretaker in the eyes of society, or they had to deal with a lot of mental health crises because they were trying to handle both online, working online, and doing all those chores. The informal sector was hit very hard. So we are talking, it's a little bit similar to what you, Aniela, were describing when you were saying about domestic workers. So informal sector, a lot of it is formed by women. So, and when we say informal sector in Jordan, we're talking about house businesses, so be it cooking at home, being a domestic worker in someone else's home, doing handicrafts and selling them, and all that kind of economy. It was basically shut down. And since it is informal economy, so they didn't have necessarily financial support to sustain themselves. There's a lot of migrant workers who work as domestic workers here. So they had increased house chores hours. They were working 16, 18 hours a day. Imagine with all the anxiety about their loved ones back home, and having also to take care of all the emotional all emotional labor of the household where they're working. In addition to that, obviously, sexual and reproductive health services were inaccessible for a certain amount of time. A lot of legal cases were suspended. Some of them were divorce cases that happened due to domestic violence, and they were not resolved because the courts were not working for some time. So the women were stuck with their abusers in the households. There was more online harassment also tracked in that period of time, because obviously people spend more time online, which means more harassment. And one very, very important point that I would like to focus on here is the tremendous increase in domestic violence. In the first 2 months of the lockdown, the Family Protection Department, which is a governmental institution, reported that there was an increase of 33% in reports of domestic violence. And it's important to note here that a lot of people do not report. According to statistics, only 3% report to a Family Protection Department. So I leave you to imagine the amount of women who are actually abused in their households for month and month without having the capacity or the opportunity to leave their households or to seek help, either because they're in remote areas or because they do not have their own phones, or because they're monitored by their husbands or partners or abusive fathers, so they cannot necessarily reach even out to organizations, feminist organizations who are trying to provide support at that time. And also a very sad number that is tied definitely to the lockdown measures is that since January 2020, we lost 17 women and girls. They left our world. They were killed by either their partners, brothers, or fathers. And one of them, and just to give you a little bit of context, in 2019, we had 20 women killed and girls. And that was 186% more than in 2018. So the numbers have been increasing, as I said, even before the lockdown, but the fact that there has been such tremendous pressure mentally, economically, and because people do not have the tools to deal with that, and because the governmental institutions have never been taking the responsibilities that they should be taking to handle these things holistically, you know, in a way that could tackle all sides of the problem. It was not done. So obviously the consequences are just aggravating. I think I spoke for too long. I'm sorry. I would gladly deepen this particular point later, but there is one important thing I want to say, because we're going to bring it up later, is that one of the women who was killed this summer is a 40-year-old woman. Her name is Ahlam, and her story is particular because it was not only because, I mean, extremely violent. She was killed by her father, and the neighbors were not able to help because the father prevented that. But that moved the street even during lockdown, but I'm going to get back to that story a little bit more in detail later.
Thank you so much, Christina, for all these details and the background information, which really helped us to understand the manifold variables at play to put women in such a situation. And here, let us hear a little bit more about India now. Radhika, maybe you can also tell us a little bit about the main problems you have observed in India, or many problems probably, but some you would like to focus on during the first months of the lockdown. But I'm going to present you quickly before we do that. Radhika Menon is an academic activist living and working in the city of Delhi, India. She has been involved in researching, working, and organizing on class and equality issues. She is professionally engaged as a teacher, educator, and works towards feminist pedagogy and transformative education. Radhika is a keen observer and commentator of developments in her country, especially on issues of gender, caste, and class. Radhika, your thoughts about the first month of the pandemic?
Thank you, Christina, and thank you, Christina and Yal from. It was interesting to hear, and rather saddening also to hear the kind of horrific details about what people have to go through, you know, especially women have had to go through in Brazil or in Jordan. Some of the situations that have developed here in the post-pandemic period are quite close to what Anil and Christina have already talked about. There have been terrible cases of violence within the household, as well as women having to work long hours and under extremely dire circumstances with very little resources, and the condition of working women, particularly from the poorer backgrounds have been extremely resource crunched, as well as they've had to face a lot of policy challenges. But it would be necessary to actually put some things into place, because what we do notice is that there are a few patterns that we can identify in the way the challenges did emerge in the post pandemic period. See, the first and foremost was the refusal, or almost a reluctance to acknowledge that there was a health emergency that was arising. While we had the first case that came in, the COVID case on 30th of January, it took till March for the union government to actually acknowledge that something serious was happening, and there was the immediate reaction was that of implementing a lockdown with a 4-hour notice, and a lockdown which went on till up to 8th of June, and after which it was tentatively lifted. But in this period, what emerged was, it's not only the health crisis, but a huge social crisis that seems to have emerged in this period, and particularly for migrant workers. And I would like to focus upon what has actually happened to the migrant working people, because they suffered tremendous losses because of because of the strategy of lockdown, as also because of the health crisis that emerged. There was no economic package or announced for a long period of time, and even when it was announced, it was primarily for it was very top down, and the money was not so much in the hands of the poor people, but in the hands of the distribution systems was very unequal. The lockdown as a strategy also happened without much planning, as a result of which what we do find is that there was a tremendous suffering that came into being. The other policy measures that did happen in this period, I would like to speak about a little later. But primarily, the emergence of women as workers, that became very important in this period. As far as the migrant work is concerned, India has has a very large section of migrant population. These are both intrastate as well as interstate, that is within the provinces of India. So according to the 2011 census, there is about 450 million migrants, and 33% of whom are workers, and which is about 148 million or so of migrant workers. And many of them are working in the construction sector, domestic work, textiles, agriculture, brick kiln, transportation, mines, hawking, and provision of services. What we do find is that the migrant workers are, there is a larger representation from certain regions of India, and they move towards areas, either towns or cities, to find seasonal work and return back to the villages when the work goes off. There is also a section of population which is also settled in the city, but with with very fragile, economic status. Women are mostly present in the construction work and agricultural work. Women workers are more in the construction and agricultural works. Typical feature of the migrant work is the low incomes that people have. And what the lockdown did was it caused tremendous livelihood loss. There was a crisis of housing and shelter as people were unable to pay rent. The credit supplies from the local stores began to dry up, so they could not access, essential provisions, including food and daily essential items. They were also denied for a lot of workers in construction sites, including women workers. Their wages were stolen by contractors who refused to pay them, and they were forced to return to the villages. So it was the return to the villages was a forced situation. So because the city could not accommodate them any longer, and because of the little planning that had happened prior to the lockdown, an unprecedented thing happened, which was a massive reverse migration by foot began towards the villages. India is a large country, so the thing is, a lot of people had to walk, hundreds and in fact even 1,000 plus 1,500 kilometers to reach their homes. And there has been a recent study in which actually said that 1 out of 4 people who left for their villages actually had to walk back. The pandemic, what it did was it visibilized this workforce. This was like the migrant workers are like it's like an elephant in the room which nobody wants to see, and the entire process of neoliberal developments that have taken place have refused to acknowledge the contribution of migrant workers. The lockdown forced the people to actually go to to visualize them, and including what happened was including the recognition that women and children are migrants. And unfortunately, this recognition has come at the cost of tremendous suffering, death on the road, death on the death on trains. When subsequently later some trains, labor trains were started after many people had already died, but the trains, there were deaths on the trains because there wasn't water, there wasn't food, the trains were taking a detour, and there were roadside deliveries of babies. There was this case of a woman who gave birth, and within an hour she had to walk. She started walking back to her village. She had walked up to about 150 kilometers in that, just immediately after giving birth to a child. So what we do find is, and not only was there was heavy-handed police action, public caning, humiliations. Disinfectants were sprayed on workers as if they were cattle, and there were whimsical corporal punishments as social distancing was being enforced when people were being walking on the streets. There was a review, the judiciary also kind of did not acknowledge the kind of suffering that was being unleashed, and there was lack of transportation, food, health, and poor migrant workers were risking their frail health by walking thousands of kilometers. And it is in this perilous journey, a lot of people died. What is stark is the class bias and the sharp contrast in treatment of international migrants that were taking place. So while concern was exhibited for these international migrants, the migrant workers actually were infantilized at some level, because their just demand for returning back to the villages to survive against illness and hunger was being dismissed as something irrational. There was state apathy. The quarantines, and when they returned back to the villages, they found that the home states did not want them. The quarantine centers were poorly managed. They had to fight extremely poor conditions over there. So in the meantime, what we do find is that this is also was the period when several laws and ordinance have been introduced which have worked against the rights of workers. This has all affected women, because women workers were invisible in this entire period, and and what happened was we began to see women on the road, on the street. They were they were sexually harassed. They had to transgender women could not find spaces. So the remedy was as harsh as the illness, and that's been a typical feature of what has turned out in the country. And what is saddening is that the visibilization of the women workforce has happened at such a tragic cost. I would, if we have time later, maybe I can speak a little bit more about some of the things that have developed since then.
Yeah, thanks, Radhika. Exactly. I think we can maybe go a little bit more into depth also in the second round of question, also with the question with the audience. Yeah, I think we can start again the round with Anieli, but also a question, of course, for all of you guys. So what kind of strategies have actually been adopted in your countries to mitigate these problems? I think you already mentioned some of these government policies, and I would like to know, like, what kind of these policies actually work, which didn't work. And I think what's very interesting, where did actually like women organization or civil society organization had to step in and do the work in order to tackle problems that the government didn't want to solve or didn't see. Yeah, maybe you could, Anieli, maybe you could give us some insights about the situation here in Janeiro and the role of civil society organizations in order to mitigate some of the problems in the pandemic.
Yes. So like I said in the first question, we had to get organized and do some stuff to help those people. In Marielle Franco Institute, the place where I am the director this year and for the next year, we had to change our priorities and we had to promote urgent actions to guarantee basic rights access to most vulnerable people. So we had to, at the same time that we had to disputing the paths on the way out of the crisis and the future of the activism and public policies in Brazil from the Black perspective, we also had to structure and strengthen the policies, management process, and sustainability for our organization, because everybody was just looking at us like, oh, Marielle Franco Institute can do a lot. And we were just starting this year in 2020. So we didn't have enough money, we didn't have enough people work with us. But even though we got together with other organizations and create ways. So we create 6 to 7 projects, and I would just like to highlight 2 of them. We create a map here in Brazil that was called Mapa Corona nas Periferias. What does that mean? It was a map that would connect solidarity in Brazilian slums and in other areas, in poor areas, in order to give them visibility and potentialize the groups of activists that were acting directly inside the more affected territories. So this map was a partnership with Twitter Brazil and other partners here in Rio. And we could help 601 slums and poor areas. They were impacted by that, and 500 groups mapped in general. So in the map, you could find a place to receive donation and also to give. So it was very satisfaction for us because we had a good result after this. Another project was called Agora é a Hora, which was very important to me because we registered the access to emergency basic income that I said in the first question from the government for 2,500 women leaderships in their places, in their community. And we had all of those women, they could help other families. So we kind of taught them how to get to this emergency income, and they helped other people. And that was like a kind of a game. You help here and someone else would help after that. So in the total of these, we kind of helped 15,000 Black women and her families that were supported in 9 cities in the whole state of Rio de Janeiro, And the last one, just to finish and so they can talk, was a partnership with a movement called Black Women Decide, which is a very young movement here in Rio. And we did a research with 350 Black women activists in all states of Brazil to find out where they came from, where they are, where they want to go after this crisis. And we found like some important results with that. The study points out they understand that Black women were not only impacted like directly by the emergency programs, but also they were the ones who were designing and implement the impact, and also show that Black women here in Brazil, the activists, were truly seeing the supposed new normal. So these were like 3 projects that we had to do in order to try to survive, and also in order to try to help not only those women, but their families and the people that were directly affected by that.
Wow. Congratulations. Seriously. I can only imagine how much work that was. And I think actually it's also something your sister, I think, also did once, like design a law bill to access a public policy that's already there, something like this, something very, Rio de Janeiro, maybe, I don't know. So Christina, tell us a little bit about Jordan. How was the situation there?
You know, every time I'm going to focus specifically, I think, on the mitigation of the issue related to domestic violence and women killings. And I want to start by this, like very often when we activists start saying, yes, the government does not see these problems, never did see, never wanted to see, or pretended to not see, whatever wording you choose, probably the pretending is the most accurate, although it's a strong accusation. People would be like, yeah, but you know, you're exaggerating. We're in the middle of a pandemic here and the government was not prepared. The whole world was not prepared. So what do you expect the government to do? And it is not necessarily false as an idea, but it's important to underline the fact that the government was able in like less than a week to provide 5,000 hotel rooms for people who need to be quarantined, either because they're coming from abroad or because they had the virus detected. But they wouldn't even think for a second that maybe there are women who would need places to stay at because they're running from abusive households. And that is not being prepared for a crisis. That is just simply not seeing women life as a priority. So obviously what happened is that civil society organizations, activists, women rights activists, they were the ones to take the lead and to do the job for the government, as you said, Christina. So a lot of the civil society actors, they were not able, because of the general lockdown, to actually go and into households and help women surviving domestic violence to either mitigate the issue or help them leave the house to a shelter, knowing that in Jordan currently there are only 5 shelters for abused women, which is very little, obviously. So what they did is, because they at least one organization I know, they asked for permits to be able to leave, to go to the streets and actually go to the households and help the women, but they were not granted those permits because their work was not seen essential. So what they tried to do instead is to maintain hotlines. And obviously a hotline is not necessarily always something that can solve a problem, but still it's a lifeline. It's a connection to someone who can actually help you. They did increase visibility on social media. So they started organizing discussions about different issues related to mental health, related to the economic situation, to help women understand and navigate this difficult situation that they are going through and all the challenges that the pandemic brought in them. But it's important to understand that all these things were happening either online or by phone. And both of those things are not accessible for all women. There are many women either live in households where there is one phone, or their phone is monitored, or that they themselves are monitored. So it's hard for them to actually get out there and ask for help. Also, sometimes when you're in the middle of a personal crisis at home, you're so much in the dark because of all the emotions and feelings and the physical and emotional pain that you're in, that it doesn't even occur to you that there's maybe someone out there who can maybe help. So you're kind of stuck with yourself and all that isolation and all that loneliness, which just makes things worse. There was, as I mentioned before, one of the women who was killed this year, her name is Ahlam, and actually her case kind of blew up the street. I think first because we knew her name. Often we don't know the names of the women because they keep them secret, basically. Second, because there was a video that went viral of her screaming in the street trying to run away from her father. So there was a lot of factors that made this case very strong. And it was in July, in a moment where people were extremely tired. We, the whole all activist circles, the women out there who feel strongly about these issues, civil society actors, we were just extremely angry, very tired. So what we did is that despite lockdown, we took it to the street. And being in the street did not solve the issue, did not necessarily bring many changes. It was more for us a space to just be out there and scream it out. But what it did is that after that buzz that happened after the killing of Ahlam, is that the Family Protection Department, which is the department that receives, that deals with domestic violence cases and women killings cases, they announced that there would be a restructuring of the institution, so that they can respond better to these problems. But unfortunately, since then we do not have updates, and there are many voices in the of feminist activists who are saying the restructuring is not enough, because there needs to be much more to that. It's not about one institution, it's about a whole mentality. It's about a connection between civil society and governmental institutions. It's about political will, or let's say absence of political will, to change these things. One last thing I wanted to say is that there was a victory that I would like to celebrate, is that one civil society actor, an institution called Sadaqa, who support, who push and lobby for children care in different workplaces. They worked very hard twice this year during the first part of the lockdown from March to July, let's say, when nurseries were closed, but then at some point, nurseries and kindergartens, but then at some point, people were allowed again to go back to their work, but nurseries and kindergartens were still closed, so women they did not have a place to actually, where they could leave their children when they go to work. And so that institution, with a lot of other civil society actors and activists, pushed for and lobbied and talked to the government and pushed it to reopen the nurseries. And they had to do it twice because, again, in October, we had a change of government. So the new government, again, closed the nurseries and kindergartens. But thanks to public pressure and their tremendous work and their beautiful organizing, they were able to reopen not both nurseries and kindergartens, but at least nurseries, which helped a lot of women. And unfortunately, I say women because men are still not part of this gig, to be able to juggle both work and childcare.
Well, thank you, Christina. Before we come to India, I just want to say, guys, watching at home, please, questions. So if something is unclear or you want to have something explained a little bit more, it's a time to get it out of yourselves and post a question, okay? So Hadika, what is your take on these situations in India? What kind of government policies did work in some way, and where did actually civil society had to step in and do their jobs?
Yeah. See, given the scale of how things were unfolding in India post-pandemic, be it in terms of the number of cases that were rising, as well as the lockdown as a health strategy, the human crisis that was emerging required basically, and it continues to require a huge kind of effort. So but before that, it's important to understand, say, what kind of policy measures were taking place. So one was, of course, the health lockdown itself. The other is the fact that, the health system was working extremely hard, and a lot of women are involved in this health work, and primarily the backbone of this, of ensuring that the quarantine centers were working, ensuring that surveys were done to identify the people, to take the messages, to take the message of how to maintain social safe distancing, and it was being done by scheme workers, which are primarily women who are not paid a wage but are paid honorariums. So the thing is, and the whole health system is working under with a infrastructure which has been weakened by years of neoliberalism. So so there is this response that is happening through this, but there are, of course, state-specific differences. Say, for instance, in the state of Kerala, which has a left government there, there were a more feminist approach to healthcare was visible. But across the country, otherwise, the general there have been some specific patterns, but otherwise, overall, the scale could not match up the kind of crisis that has emerged. And unfortunately, what has happened parallelly is the continuation of business as usual as far as neoliberal agendas are concerned. So there have been a lot of ordinances and through non-parliamentary democratic procedures by introduction of labor laws or the laws that impact farmers or even education, which has kind of has deep and long-lasting impact on the lives of women workers, women peasants, women and women in the women trying to access education and employment in future. Also what has happened is the kind of money, as I've mentioned earlier, the money is being put at the top rather than at the bottom, where where it would have helped in actually reviving an economy which had got devastated post lockdown. So so what we do, there are a couple of things that we need to remember before I speak about exactly what kind of strategies people did come up with. Say while the state lockdown itself kind of failed, what is notable is that there was also been an inconsistent stance as far as COVID is concerned. So for instance, when it was there's been a lot of political maneuvering during the pandemic, and it is as if the COVID did not exist when something like elections had to be held or large gatherings for political agendas that suited the ruling government had to take place, be it like laying the foundation of a temple. So for this, large gatherings were taking place. So what actually has happened is it has been left, the COVID-19 appears to exist only in hospitals and left to healthcare workers to deal with, or it has been used for communal coloring or for declaring protests as illegal. What has happened as a result is there's been an increasing skepticism about the existence of COVID itself, and until death has come to the doorstep, and a large number of deaths have happened. So, but because of this coming together of of political maneuvering over COVID, as well as this policy of lockdown, which kind of failed, along with the health infrastructure which was collapsing, things have been really difficult. Unfortunately, unnecessary, at the same time, there have been necessary measures like food and the midday meal schemes, which kind of ensured that children got food at home, food in the afternoon, food from the school, which ensured that their nutritions were taken care of. Some of this has suffered as a result of the lockdown and as a result of the pandemic shutdown of schools. So, and the girl children have particularly suffered as they've been denied meals, they've been denied education, they've been denied the access to education, which especially girls from poorer working backgrounds. So, while there's this huge thing that is in front of us, there have been, at another level, we do find there have been practices, particularly, specific state-specific responses in healthcare. But as far as the civil society is concerned, and deaf mass organizations or women's organizations, they work towards, mitigating some of the damage that have been done by the policies that have hurt workers. I think this is important because as I mentioned, the remedy was worse than the illness itself. And when workers were going back to the villages, there's been a lot of work from civil society and mass organizations for organizing relief for those who lost their livelihood, be it ensuring food and ration to the homes of people, of workers, and ensuring that shelter was available to women, that medicines were available, masks were made available, and mostly through public collection and mobilization of funds. So all these were voluntary efforts, and spontaneously, it was beautiful at one level because people, what did come out during this extreme moment of crisis was people's own humanity and recognizing the values of concern and care, such important feminist values that way. In the larger mass of people, and people were all, there've been efforts to organize transport to get workers back, organizing temporary shelters. You know, this has been in terms of more in terms of providing relief. On the other hand, there have also been efforts to provide better, mobilizing the workers for relief, getting better quarantine and health facilities, getting separate quarantine facilities for women, keeping in need their, their health and hygiene concerns, and organizing. Also, there have been efforts to organize the health workers. As I mentioned, a large number of the scheme workers who have been the ASHA workers, they've been the pillar of health, during the COVID times. So organizing them has been an important part, because they have put their lives on danger, and they're working under extremely harsh conditions without salaries, just just for an honorarium, and organizing them, ensuring that their health care is also taken care of, ensuring that they are mobilized, that they also they're able to take. That they were able to work with adequate motivation, and that can only happen if they're organized and struggle for their own rights. So this has been an important part of of women's movement also, because especially because the ASHA workers or the scheme workers who are providing health, they're entirely women. There have been, at another level, an important part of this response, feminist response to women's movement's response to the pandemic has been working towards visibilizing the role of women, visibilizing the women worker, the migrant woman worker, because they were invisible in media, they were invisible in policy, they were invisible in public perceptions. But visibilizing them is an important part of ensuring that policy takes care, policy responses happen. So that has been another area of work, and there have been at other levels, as in there have been, of course, cases trying to do what can be done in terms of responses to the offering support for domestic violence to victims of domestic violence and assaults, and mobilizing for shelters. But this has been difficult because a large part of because of confinements of activists themselves within the house, and declining democratic spaces because of the lockdown, and so a lot of it had to be done online. At the other end is there is another important thing that has happened, which is the visibilizing of the work that women do in the care sector. What has clearly come out is the important role that women have played in the health sector, and women have played, in the education sector, because these are things that have kept functioning even during the lockdown. And also the importance of domestic work has got highlighted in this period. So this has been visibilizing women and women's role, mobilizing them for on rights has been an important part. Yet another important area has been, because of the shrinking democratic spaces, the women's participation, the protests and the mobilizations have seen increase. Any be it for democratic rights, have seen increasing participation of women. Women peasants are coming out, as in the recent weeks. There are hundreds and thousands of women who are there in the farmers' protests, and this visibilization is an important part of coming to terms of the public perceptions. Coming to terms with the fact that women are farmers, women are workers, women are are providing health, are providing education, and they're probably doing the most important work which nobody wanted to see. And I think this has been mobilizing and visibilizing and organizing has been an important part of some of the important feminist work that has happened.
Well, thank you, Radhika. I think it's something we can definitely reflect on, especially also now with the last round of questions, where we're actually getting to, I think, what would be so interesting to discuss with the three of you, like what would you say actually what you have learned out of your own activist work or feminist activist work, or what you saw in your organizations or other organizations in this pandemic. I mean, what kind of actually knowledge or lessons could you share, you know, with activists in other countries, especially maybe from the global north, you know, because normally there is this kind of like knowledge transfer from north to south, and I think it's so much more interesting to maybe think it also the other way around, and what can we actually learn from these organizations that you guys have, or that you know so well. And well, again, we can maybe start with Anieli, who I also know has to leave us soon. So maybe you can tell us a little bit about like the lessons learned maybe of the Marielle Franco Institute or other institutions that you want to talk about, and what we could, kind of knowledge you could share with us.
Yeah. After they had killed my sister in 2018, I would say that all my experience and knowledge come from this point on, you know, because we had to restructure our minds, the way we work, to be more worried about our government and things that they would do with us feminists. And when 2021 arrived, we had a whole new idea in mind to do a lot of stuff, but we had to change the key and start doing something else. One thing that I've learned was that civil society organizations have to come together every time, especially when we're talking about feminists and feminism, because we have a government that don't look for us. You know, they don't look at us, and they don't like feminists, and whatever they can do to avoid us to be in power or to be in charge, they will do. This year we had the first municipal election after my sister have been killed, and we got a number of, okay number for women who were elected, but it's still we have very few women in power in Brazil, either in the municipal elections or federal government. So hopefully in the future, since we now are so, I mean, not now, we've been doing it a long years for a long time, but this year I could see many women organized with us in our organization doing a lot together. So maybe in the future we are going to be able to have more women in the politics, you know, in places of making decisions, in place of where they actually can do not only like we did, like giving food and etc., but doing other stuff. But if I had to highlight, I would definitely say that being together with those women here, especially Black women, for me was a great experience. I learned from them, you know, and I'm pretty sure that if we didn't have come together as feminists, even more people would be dying in Brazil right now. So we work collectively towards our city, our community, our women, our children, and so on. And yeah, I hope we can continue doing it. And I hope that one day our government will just look for us and look for the country in a different way, saying and doing things that could avoid us to be so poor, you know, and keeping dying every other day over here. But yes, thanks again, Christina, for the invitation. Thanks again, Christina and Hadika, for being here with you guys. I'm gonna leave a little bit early because I'm gonna just pick up my father from the hospital. He had COVID-19 and he's been there for now 16 days. And they called us like a few minutes before we start here to let us know that he can come back home. So that's all I'm not gonna say for the questions, but it was a very pleasure to be here, and now we'll be in touch and keep going from
Anieli,
here.
thank you so much that you have been here with us, and we're so happy to hear the good news about your father. And really go, okay, and take care, and
Thank you, guys.
all the best for your family, okay? Bye.
Thank you so much. Bye bye.
Okay. Maybe Christina, you want to continue with the same topic? What kind of lessons learned? What kind of advice would you have to share from what you saw or what you did yourself in your organization?
You know, it strikes me to hear what I was hearing tonight is we are not visible, they don't like us. And it's true, but I think it's not that we're invisible. We are very visible. We are very loud. We've been loud for hundreds of years. And we're still talking about, in some places, the same things women before us were talking about. So I'd call that selective blindness, you know, and I think I'll start from here. I think that before we give advice to each other and before we see how much we can learn from ourselves, I think it's important that we call on those governments that do not like us, that do not look like us, that do not think like us, to remind them that they do need to listen, they do need to see, they do need to remove that veil from that they have put deliberately on their eyes, because there is no other way to create a place that is sustainable for the lives of everyone in the society. And they do need also to get humble and say, yeah, there are things we don't know how to do, and that's okay, because there are many activists and civil society actors, educators, brilliant professional people, researchers who have been out there for years. They've been doing amazing work. They have a lot of accumulated knowledge and a lot of accumulated know-how, and it's there. We need to get all together, but not only as feminists, but the governments need to make sure the public spaces are not suffocating. They need to make sure that these civil society actors are able to do their job, and that they wouldn't be doing the job of the government, because what's the job of the government is the job of the government. What we can do is help them to see the way. We can guide them. We can work together until we manage to create holistic policies that do honor the lives of all members of the society, especially those who are very vulnerable at the moment. And from here, I'd go to us feminists. I think I like this us because one of the things that I've been contemplating a lot is how difficult it is to put the us before the I, even in activist work. And I think there is no way for us to go forward if we do not do that. And also, I've been reflecting on how difficult it is to actually reach out, especially when you're extremely tired, when you're extremely angry, when you feel like whatever you're doing is not enough, neither as a person, nor as a collective, nor as an organization. It feels like no matter how much you do, you need to do more. You're constantly asked to do more because there's constantly more disasters on the way. And I think reaching out and maintaining existing networks of solidarity and creating new ones is extremely difficult, especially in times as the ones we have now, because this neoliberal system and this approach of the individual well-being, especially when you're not well, kind of sometimes takes the toll, and you kind of feel sometimes that, yeah, maybe actually I just need to take care of myself because I cannot do this anymore. But it's precisely in these very hard moments, I think, I'm not sure it's a thought and process, but I think it's specifically in these hard moments that we have to remind each other and ourselves of the strengths that we can have when we actually act together, not only based on our own experiences, but also based on the experiences of others, on the tactics of others, either other women and activists in other countries, or women and activists who have been long before us and who laid a ground. And one last thing I wanted to say is, I think in some contexts, it's important that we, like in moments when we have low energy, let's call it, it's important to revisit the tactics that we use. So maybe it's important also to remind ourselves that it's not everything at once, but it's one thing at a time. And that means choosing the proper tools for a specific objective. That could make our work easier, our mental health better, and maybe even result-wise, it will be better. And this thought came actually as when I was rethinking going to the street during the lockdown. I think it was important, as I said, because there was a need to put that to get the lid off the pressure pot, you know. But it did not really lead to anywhere. But it did actually take a lot of our energies to organize, to argue, to try to get permits, to do all that work that could have maybe put in somewhere else and had maybe better results. So yeah, I guess that's it. And yeah, no, actually one more last thing. Thinking about this whole online activism, I was thinking that I don't know how yet, but it's something that I'd like to put on the table, and maybe someone else will develop on that thought and put it into use. I think it's important that we, especially in in specific contexts and in countries where maybe accessibility to all digital rights are not are not that great, and the accessibility to online platforms is not there. That now it's the time to think what to do in another total lockdown, how to reach out to women who are not whose lives are not that digital yet, or and also to not forget that being online, it means being slaves to algorithms of social media, and that's not an easy thing to handle either. So it means again that information reaches those people who are looking for it, who like it, who I don't know, who look like it, or whatever the factors are. So we do need to get out of our bubbles if we need to reach more women with specific information or specific support. And I wish I could share an idea of how to do that, but I'm not there yet.
Well, thank you. I mean, maybe Radhika has some ideas, or the audience. We can discuss collectively. But first, Radhika, share with us some insights from India.
See, what is clearly emerging is the fact that I agree with I agree with Aniel about women being present in politics as much as not just organizing relief, but in politics, how it's become so important, how organizing and mobilizing has become such an important issue. And we have, for us here, we have never more experienced it as strongly as now, when when these things are becoming even more increasingly important, both in terms of women's mobilization as well as larger mobilizations of workers, farmers, and other people who are affected by the neoliberal order. What is also emerging is clearly that that a neoliberal health system is not going to be help anyone, and the health crisis is only going to increase. And as we see it here, leaving it to the poorly paid health worker who is a volunteer, who gets a volunteer honorarium, is not going to help the larger society's health needs, or nor is it going to serve the rights, the wage rights of the women workers who are involved in this scheme work. The other element that has become increasingly important for us is this is also a time where it has become possible to highlight and point to we've always been talking of women, the different kinds of work that women do, but this is the time to take it to a larger public, to larger, in terms of educational aspects of feminist work, and taking it to a larger public, to opening it out, especially the aspect of how women's work has been central to ensuring that people have survived through the pandemic. These have been the crucial areas, work at home, work in the health sector, work in the area of education. These are areas where women are represented more than in other places, and these have come out as the most important areas of work also during the pandemic, and highlighting it is important. There are many areas which have got neglected Especially, for instance, the issue of shelter that Christiana had also has been talking about, the need for safe shelters, the need for women to have the rights to housing in their own house, to escape violent homes, for the rights of transgender people who are, who suddenly found that they did not have any place to stay, neither in their natal homes nor in the communities that they had adopted because of sudden lockdowns that took place. So the importance of mobilizing on shelters has become an important area for women's movement. Another and in the very significant area is the important to organize over public distribution systems of food. And the pandemic has posed, the lockdowns, the loss of livelihood has led to food. Food. There are always issues of food distribution being unequal for women, and the rights to food within the household, within the rights to nutrition has become once again important. Christiana also had mentioned about digital inequality, and this has become particularly conspicuous as far as girls' education is concerned, and girls have suffered tremendously as a result. And what we fear, especially some of us who work in the area of education, we feel that it's a major setback, the girls' education, because of the absence of the entire online forms of education implies access to digital technology, the hardware for it, the connectivity for it. And there have been study after study which have said that women's access is far less than that of men. And so if the entire educational pattern is going to emerge through these formats, it's going to have a serious crisis in terms of women's access to information, women's access to education. So this will become an important area for mobilization. It is particularly so because there are huge companies and corporates and transnational organizations which are kind of with very very powerful transnational companies who are controlling the digital access. So how it is going to pan out, what will be its implications for women? We are already seeing that it's going to set back women's education. So this is one more area of work and mobilization that will have to take place. In terms of what we have learned and what I would like to share is that what we're clearly seeing is that a post-pandemic world is being crafted now, and there is a very harsh neoliberal order which is utilizing traditional inequalities, and it's reinforcing it through conservative forces, and new inequalities are coming in. And what we do find is that women's autonomy choices, for instance, there have been massive attacks through legal measures on women's right to the choice of partners from another faith. That has happened in the form of a law in one of the states of India, the Uttar Pradesh. So this pandemic has also been used to curb women's rights or rights to their choices, their choice of partners, the women's rights to move in public spaces, to women's rights for their wage rights. So mobilizing on these grounds is clearly important. And what we do clearly notice is that the energies of the progressive democratic movements, are being cast now, and it would, and gender equities and concerns are going to clearly emerge in these times. And the protest spaces are also increasingly becoming feminist spaces. Feminist not in terms of the way people misunderstand it, but in terms of feminist, in terms of the kind of values that are becoming essential for these protest spaces. At one level, the neoliberal apologists are willing to put profits before rights of women, and for this they are willing to tie up with extremely conservative forces. But on the other, we find that when women have mobilized, when they're present in large numbers, there have been transformation of the protest spaces also. And these places are becoming places of care and concern, where there is, there are, for instance, there's the sharing and serving of food, children sitting with parents as they say, as they wait out at protest sites, women's menstrual concerns becoming concerns for everyone, as safe spaces for women are needed, harassments question becoming a national question, assaults of women becoming a national question. These are emerging from the protests. And I think these are transformation of the protest spaces as feminist spaces. And I think there's a lot to learn from this. Also these are work in progress. These are things that are happening, and there's a lot of possibilities from these struggles. And I'm sure across the world, when women do enter protest areas, how they transform these spaces, how they transform these struggles to make them far more inclusive, more participatory, more democratic. I think that's what those are our feminist concerns.
Well, thank you, Hardika. Well, actually, there are now a couple of questions from the audience, and I also do have a question. I think I can just throw a couple of questions at you, and you see which you want to engage or not. I think first of all, what would interest me, what I have been thinking during the preparation of this year, but also working with other related topics, is that also I think it makes increasingly more sense to use the term of state violence, maybe in its more stricter sense, also sometimes in its more broader sense. So maybe you could, if you would like to elaborate a little bit about police violence against women in this whole context, which would be the stricter sense, or looking at state violence in a broader sense, not guaranteeing shelters, for instance, leaving women left at home with their abusive partners. And maybe also the question of administrative detention, which is obviously a big thing in Jordan, protective custody, this kinds of stuff. And also a question we got from the audience about domestic work, or the lack of regulation of it, especially when it comes to migrant workers, is also something what we could maybe put under this umbrella, or address in this discussion about state violence against certain groups or certain women, right? And then another very interesting question is also, now that we talked about feminist mobilization and what we learned and kind of knowledge we gathered, what actually about transnational feminist exchange or network, how do we do to work more together and to make this exchange quicker, right? Yeah, I think maybe if you want to address one of these aspects, I think we all would be very curious to hear your opinion on this. I don't know, Christina, if you would like to start, maybe.
Yeah, regarding state violence, so as I mentioned, the Family Protection Department is a department of the General Security Services, and they are police force, let's say, but they do have many more mandates than police does. For instance, they are allowed to offer reconciliation, or they allow to a woman who's beaten, let's say, by her father. Which is not something a regular police will do, right? If you, I don't know if your credit card is stolen and you go to report it to the police, the regular police will not tell you, oh, listen, maybe you'd like to just, reconcile with the man or the woman who stole your credit card. There's no need to make a big fuss here and file a complaint. But that happens in the Family Protection Department. And also the problem with this department is that even when so first, they have mandates that do not make the situation better, in the sense that they do not protect the woman. Second, they are allowed.
Christina, just to interrupt, just to clarify one thing for people who might not be so familiar with the family. So if I'm a victim or a survivor of domestic violence, I would go to the family protection unit in Jordan. These would be like the responsible people for my problem.
Yes,
Okay.
exactly. You would either call them or go to their department and file a complaint, and then they take it from there. They have caseworkers and they take it from there. Now, the problem is that since they have a lot of mandates, and since we are talking about family, and family is as a concept is very important in the Jordanian society. So often they're allowed by law to, based on their personal judgment of how a family dispute should be resolved, they can take action, and they do have mandate for that. So it goes back not to clear policy, protective policy, etc., but it goes back to personal judgment that has a legal basis basically to act upon. And often, even let's say there are some trainings that the officers in the Family Protection Department they undertake to learn how to deal with survivors of domestic violence, how to ask proper questions, how to make sure to go through the process as smoothly as possible, taking into consideration the sensitivity of the matter and the emotional and psychological well-being of the survivor. Those people who undertake, they do not remain necessarily in the protection department. So they do not get to actually practice and build upon the experience, because they get moved to other police departments in a rotation system. So all these things make this department not necessarily capable of doing its job of protecting women and children who live in violent households. Another thing, so this is one of the examples of how state violence can be translated. Another issue is that, as you mentioned, the protective custody. So in Jordan, there is the system that there are shelters to which you can go which you can be admitted if you survived abuse in your family. The problem of these shelters is that if you have your children, so if they're under a certain age, they can be with you. If not, if it's a boy, it's going to go to one something like social service house, or like an orphanage, let's say. And the girl would go, the boy would go to one, the girl would go to another. So you would be separated from your kids. And if after 6 months the case is not resolved, then you are put into protective custody, which means you're basically imprisoned. So you are there in prison without your children, under the pretext that you're being protected. And there are women who've been there for years. And obviously the prison is not the most friendly place in the world, let alone the fact that there is no assistance for you to be able to handle what you were running away from, plus put on top of that the accumulation of stress and mental distress that can be caused by the fact of being literally in a detention center. And suddenly, from a victim, you become a perpetrator of something that is not even named, because technically, if we punish someone, we punish them for doing something. But here, what you did is that you escaped death, maybe potentially, or lifelong abuse, or economic abuse, or so there is I think what's important. I really like that you brought up the term state violence, because I think what's important is to name things by their name, to not pretend they're something else than what they are. And when it comes to protection of women's lives and bodies and health, very often the concepts are, there's kind of a disillusion, and there's the concepts are kind of fluid. Suddenly things are not what they are, and that makes solving the problem more difficult. So and as an example is, as I said, like when suddenly the survivor becomes someone who's accused and being detained instead of the person who perpetrated the violence, or when women are even questioned in a way that she needs to prove. And I think this is a problem, a global problem, unfortunately, still, is that often in a lot of countries still, women need to prove that what they're saying is true. Let's say that they were abused, instead of the perpetrator having to let's say deny. Like it's just the other way around, no? And obviously that puts them under a very harsh questioning. It looks like an investigation. Often they will be even left in the households with the abuser. They wouldn't even make it to the shelter. Or for instance, the caseworker would disclose very sensitive information that the woman told the person and use it, for example, to threaten the abuser, and then leave the woman with that abuser after the abuser knowing all that very sensitive information that could actually literally make him super mad and just, and kill her, which happened in some cases. So I guess it's important to, just to finish the thought, to stay vigilant, not lose guard, and not be afraid to call things by their name in order to potentially find solutions that are long lasting and that wouldn't be fragile, and so that they're not taken away in a glance.
Well, thanks for this thought. Rajika, do you have any thoughts about state violence, or you want to say something about transnational feminist exchange of knowledge?
See, as far as we've witnessed state violence in most blatant form in what was unfolding during the lockdown. In fact, a health strategy that had gone wrong became a part of state violence in terms of what the workers, particularly migrant workers, were being subjected to, and the humiliations, public caning, a lot of these things, and with impunity, corporal punishments were being given. State violence was, it has become part of the structured violence as even judicial support for the workers were not available. At another level, what we do find is that this is a lot of things that have been won over after a long struggles. For instance, the number of hours of work, they've all got undermined in this period. During the pandemic, several laws have been been brought in through ordinances, whereby the labor laws have been transformed, the hours of work have increased, the rights of workers to unionize. There are, many of these things have got undermined, and what has been won has been taken away. So so the state is operating on the interests of neoliberal forces and consolidating consolidating the interests of the neoliberal forces, and it is willing to unleash state violence on and there is a class violence, the state violence is assuming, the class violence is assuming, is being perpetuated through state violence. And that's an unfortunate development that's becoming more and more clear during the pandemic. There is one question about regulating domestic workers. Of course, it's extremely important because they represent one of the casual workers. Women overrepresent domestic work, and they were the first to lose the jobs. They've had to suffer terrible humiliations. In fact, they were the first to be ousted from homes when the work when there was suspicion of infections spreading, and when they have returned back to work, not only has have their spaces and spheres of mobility been restrained within the households that they're working in, but also their arrival to the places of work, all that has become constrained. So as much as it is important to organize domestic workers, what we do need to do is that even the health workers, that's what I was arguing, that even the health workers who are working within the government sector, who have become the backbone of the pandemic care, they have to struggle for a salary, let alone they're not even they're just being paid, they're not even being paid a wage, they're being paid an honorarium, they're working as volunteers. So regulations, there are many kinds of regulations that are required, and if we look at the kind of and the case of scheme workers who are working as as volunteers for honorarium, is a classic case of how women's work is undermined, even by a state whose outlook is patriarchal, who's willing to who's willing to implement neoliberal policies in the health sector, and by playing down the wages of women. So I think a lot of regulation is required, a lot of struggle and mobilization is required to in new areas where there is casual work, but also in areas to also to preserve what has already been won, because that is also being undermined through ordinances and laws, as I have mentioned earlier.
Well, thank you. I think we're already a little bit over time, but maybe we can have very last words from you, and then we wrap it up here. Yeah, maybe your final considerations, but maybe also if you could like say what kind of gives you hope these days, like to look forward a little bit to the next years, or what gives you strength? It's maybe the more appropriate question, but maybe something you want to share with our audience before we go. Christina, you want to start?
Actually, my answer to this would be a little bit intersectional with the question about transnational networks. I think what gives me strength is actually a very hard question these days. Because as the end of the year approaches, and as I have this heavy feeling in my heart that this is not a year that is supposed to be on the calendar, as it was quite disastrous. But what gives me strength, I guess, is to see the struggle of fellow activists, not only in Jordan, but also abroad, and to see also how much in these past month, where we were all kind of locked up in our cells at home, how many transnational panels there was out there, and this is one of them. How many attempts there was at sharing thoughts and knowledge that is being produced on the go as we speak. How much, like seeing also how much lots of activists and organizations were overworked and still being able to push, because there's out there who need support now, and it's not it's kind of also a response to a pandemic. That's also frontline work, it's not only as you, Radhika, mentioned, it's not only about healthcare, it's a lot of other things that were going at the same time, and seeing the courage and aspirations and capacities of all these people, I think that's what gives me strength. Sometimes it's not enough, because the amount of anger and disappointment and frustration because of the not only the local but also regional and international situation on all levels, be it economic, social, political, it kind of makes it a very hard task to keep hopes up. But I guess it's a matter of choice, and if we choose life, we choose resistance. Christina, you're on mute.
Oh, I'm sorry. I was just saying I don't even know how to comment this. I would just let it stand in the room. But maybe Radhika, you have some last words also.
I think these conversations are hopeful because a lot of us are, these are difficult times across the world. I mean, we are seeing there's a consolidation of extremely conservative neoliberal forces on one side across the world. And but there are also there's forces of resistance, forces of hope, transformation. And I think it's nice to understand and listen that, of course, across the world, people are trying to change the spaces that we are living and working from. So during the pandemic, it was it was interesting to see how the sanitation workers, the health workers, they continued their work. They were, everybody was locked up, but they continued to work, and they made sure that that everybody was that we could continue in spite of extremely difficult circumstances. things were kind of falling apart, falling during the lockdown, and livelihoods were being lost. But the diligence with which, even poorly paid, overworked, understaffed, health systems were operating, sanitation systems were operating. I mean, the power of people to want to ensure humanity continues and survives. I think that's a beautiful thing to live with, and that does give hope. It was also hope, and it was wonderful, as I mentioned, to see the humanity that came out when people organized spontaneously to organize relief for workers who were stranded, who were trying to get back, who were living. So that does give hope. What also does give hope is the fact that the sites of protests that have emerged in this year. I mean, for us in India, this year began with protests, and it seems it's closing with protests, different kinds of protests. I mean, there were protests over citizenships, there were protests over the labor rights and on farmers, and as in the current circumstances. All these spaces, there are women present, and women's questions are becoming important. And there is care and concern that is visible in these places. These protests have actually defied ageism, and it's very, very old women who are coming out and protesting and being present, and the elderly people who are, elderly women. It's very, very, people in their 70s and 80s, and they're coming out and protest, 80s protesting, and with very young people. I think the fact that people don't want to take things lying down, the fact that there is a desire to change the system, that there is another world possible, that imagination does exist in spite of the fact that there is things are kind of getting so tough. That does give hope. I think one should not lose heart, because it's not going to get us anywhere.
Yeah, no, definitely. Yeah, I mean, I can also just say what really brought me through the first months of this pandemic was together with Isadora, to be able to, edit this dossier and kind of bring together all these voices of really inspiring women from all over the world, sharing their reality and sharing their realities of social struggle. And being able to put a collection like this together was really, was a really kind of empowering experience, I think. And also these kinds of talks, they always give us a little bit of sense that we're not alone. We're contributing to something bigger, right? And I think it's very important to kind of keep hold on this thought. Because, it's not only the pandemic. I mean, look outside, what 2020 and what they're trying to do with the kinds of rights that our mothers or even grandmothers have conquered already, right? And the kind of stuff we need to go on the streets these days to what I always took for granted, right? I think it's very important to be together and to share, and also to kind of, what Christina also mentioned, to kind of take care of our heads, to invest in a little bit of self-care, because we tend to forget that. But it's very important. And I just want to thank all of you for all your very inspirational words and your time. I really want to thank the Global Feminism Department at Rosa-Luxemburg, especially Alex, to making all of this possible and to being there throughout the process of putting together the dossier, and also to, connecting me with some of these amazing women such as Radhika, which I didn't know before the dossier. And it has been a rough year, but it has been a good year in terms of meeting really inspiring people. And I think this is something we can always, take out of the situation, how bad it might be, right? You always meet someone. You always meet someone who will give you some kind of idea that make you want to get up the next day, right? So, and I think we have to look forward. We have to get up. There's still lots of stuff that we need to solve in this world. or that we need to defend in the first place, that the stuff doesn't get worse. So thanks everybody for watching. Again, sign up to the newsletter, read the articles on the dossier, and have a good Christmas and come good into the next year. Thank you guys so much. Bye.